We can't solve problems between patients. You can't fix the plane while it's flying. You can't be working on a patient. Your office manager comes to you, we're having this problem. Let's do this. In order to fix anything, you must meet to compete. So that you're going to have to designate separate strategic planning time to be able to make these kind of advancements.
I'm Dr. Rick Steedle with some useful ideas for the successful, not stressful practice.
I know the resistance. I'm paying all these people to sit around and I'm not getting any production out of it. My thinking on that is we are doing something that is going to have such a return that this money and time we're spending now is going to be worthwhile. And it has to come down to having a great meeting. We'll talk about how you have a great meeting. What are the types of meetings you might have? When we really got this down, there were 4 types of meetings that we had with the staff. The first one was the morning huddle, which is basically you sit there 10 minutes before patients show up, you review the day and you're planning for the day. You're saying things like, Bobby's coming in today. He's someone who's a little bit autistic. Let's put him in the private room. I look at the schedule and we see that at 10:30 it's going to get tight. Okay, so let's do this. And I'm going to give you a format for that. There's a report coming from everyone in that meeting. Clinical is going to look at the schedule, give the whole group a report. The treatment coordinator is going to talk about the new patients, and everything is going to be planned out. And you're basically just wanting the day to go smoothly. The second type of meeting is a general staff meeting. Now, when we had 26, 27 employees, you can't solve any problem in a group of 26, 27 because half of them are going to be half asleep. This doesn't relate to me. I think that general staff meetings, which we held every quarter, was simply to do the routine stuff. We got to sign these forms for our new insurance. This person's going to explain that new insurance to you. So something that's just general information for the whole staff. You're not going to try to solve problems in a general staff meeting. And I would purpose them totally different than the other kind of meeting I'm going to talk to you about. Next thing would be the periodic reviews or performance reviews. We did these every 4 months, so 3 times a year. And the idea is staff development, one-on-one meetings with staff, giving them 3 goals for the next 4 months, something to achieve to make progress personally and also make progress in the practice. But the kind of meeting I'm talking about is what I call a project team meeting. And that's a meeting in which we're going to sit down and solve an issue. That 2 or 3 issues that you're going to have. Those meetings ideally are probably once a week or once every 2 weeks because you don't want to lose momentum on a project. And project teams, it's to gather to talk about a specific issue. And you're going to identify that next challenge. And you're going to say, these are the people we need to get together. So for example, you're having problems occasionally missing lab work, or the staff is complaining the assistants aren't helping out at the end of the day, or collections are down, or we're always running late with patients. These are the issues that you're going to gather together a project team. And you may have 2 project teams. You may have a front desk project team and a clinical project team. And when we did this, usually I was running the clinical one and the office manager was running the administrative one. And each one of us had a system we were trying to resolve. You have to ask, who goes to those meetings? The people you want at the meeting are what are called stakeholders. A stakeholder is someone who's going to implement the system or is affected by the system. According to Harvard Review, ideal is 4 to 7. So if you have a small practice, when you only have 4 to 7, I'd get everybody in the meeting. Let's just be all on the same page. When we had 15, 20, 25, that's an unmanageable meeting. So we would say we don't really want 8 to 10. We probably want about 7 at the most. Stakeholders in a specific project, let's just call it collections. So we want a representative from the front desk so they can give their perspective on collections. Treatment coordinator. If we have a financial coordinator who's separate from the office manager, you want the office manager. You want probably 1 representative from the clinic. Because, for example, if this patient is behind, if that patient is seated, how do we know that patient's behind and are we going to do something different? So we need that kind of input from the front. So maybe those 5 and me, 6, would be the stakeholders. What we're doing at this point, if you remember, we're creating the vision, we're going to make sure we have the resources, and then we're going to create a system. So everyone now can give their input into that system and make sure that something we decide isn't missing. Second thing you need to know, here's how you do it logistically. You extend a lunch schedule by 30 minutes. Let's say your lunch is from 1 to 2. So you extend the lunch on that particular meeting day and you wrap up patients at 12:30. So that gives about a half an hour to wrap up in case someone's running late or a bracket was off very late in the morning. And so that by 1 o'clock, they could have wrapped up patients and gotten their lunch. And then You meet for 45 minutes and then give them 15 minutes before the start of the afternoon to brush their teeth, get their cart ready, and all that sort of thing. So your schedule says we stop at 12:30. Your meeting starts at 1 and ends promptly at 1:45 so that everybody isn't late for the 2 o'clock patient. We decided, you can decide anything you want, we decided Tuesday is the best day. Why is Tuesday the best day? Because Monday is often slammed. Tuesday, you sit there planning. You've got Tuesday afternoon and Wednesday and Thursday to work on whatever assignments you had from that meeting. Say, okay, we need to get this information. We need to do this. If you make it end of the week, by Monday, I don't know about you guys, but I've watched a few Netflix series. I don't remember what we talked about last Thursday. So I found that Tuesday is the best day to do it because you can accomplish more during the week. And finally, yes, you pay them. It is required by law. Anytime you make it mandatory for someone to be somewhere, you have to pay them. If you want to discover more ways to make your practice more successful and less stressful, check out this video right here. I think you'll enjoy it.